Welcome to part 2 of knee complex biomechanics. And those of you who didn't watch the part 1 of knee complex, please do watch that. There are many important topics in that, and it is only 10 minutes, and that this kind of vast topic is just finished in 10 minutes. So just do watch that. And yeah, I'm going to start with the part 2. Now, the topics covered in knee complex part 2 are knee joint capsule, knee ligaments, screw home mechanism, also known as locking and unlocking mechanism, patella, patellofemoral joint, patellar movements, patella alta and patella baja. Knee joint capsule. It has role in stability. It restricts various movements so that it doesn't go to any major injuries. To maintain joint integrity and normal joint function. It acts as a capsule, helping synovial fluid intact. Now attachments. Now posteriorly, it covers joint totally from inferior part of femur and superior of tibia. Anteriorly, patella quadricep muscle. Superiorly and patellar ligaments inferiorly. Condyles of tibia and femur are covered. Knee ligaments. Functions of knee ligaments. The knee ligaments prevents excessive knee motion, varus and valgus stresses at knee. So that the ligaments prevents the varus and valgus from the knee. Then anterior and posterior displacement of tibia, medial and lateral rotation of tibia, stability of knee joint complex. Now the ligaments are lateral collateral ligament, medial collateral ligament, anterior cruciate ligament, posterior cruciate ligament. Moving to next slide. Locking and unlocking of knee, also known as screw home mechanism. Now guys, this is one of the important questions that you have to learn. It will come for your theory exams for 5 marks, and that is for sure. So let's begin. Standing for a long time without much muscular effect is possible due to locking mechanism of knee joint. Locking of knee joint, coming to that, medial tibial condyle is more in size than lateral tibial condyle. During last 30 degree of extension, which means when it goes to full extension, before that state, lateral condyle of femur gets completed with its contact on tibia condyle. The movement of medial condyle of femur is continuing. Now, lateral condyle of tibia acts like a pi bond. It acts like a pi bond. Now, please do know that word. So that the medial tibial condyle rotates laterally and completes its movement. Now, extension is associated with lateral rotation, so that there are two different motions. Now, that's why it is called coupled motion. Now, let's discuss about unlocking mechanism, shall we? So, before starting, just remember that locking means extension, unlocking means flexion. Okay, so now initiation of flexion begins with medial rotation of tibial condyle, and popliteus muscle supports this rotation movement. So now flexion is associated with medial rotation. Now this is also known as a coupled motion. Coming to the next topic, patella. Now patella is known as the largest sesamoid bone in the body. It is triangular in shape and the bone is embedded with quadricep tendon. As you can see in the image here, the top part is the base and the pointed area is known as the apex, and you can see medial border and lateral border, and it primarily acts as an anatomical pulley for quadriceps muscle. Coming to next topic, patellofemoral joint. Now articulation between distal end of femur and proximal end of tibia and patella is patellofemoral joint. Patellofemoral joint is the most incongruent joint. It is the most incongruent, which means it's not stable. It is incongruent joint in the body, as patella is too small compared to the distal part of the femur. Patella is attached inferiorly to patella tendon and tibia tuberosity. Patella is fixed with medial and lateral ligaments and muscles. Patella got motions like flexion, extension, lateral or medial tilt, then lateral and medial shift, lateral and medial rotation. Now coming to the next slide. Patella flexion and extension. Now, as I have mentioned before, that the patellofemoral joint is an incongruent joint. So it is going to be interesting to talk about it in this topic. So the tibia moves for flexion, assuming femur is stable or fixed. So let's say inferior glide of patella. Initially, patella follows direction of tibia, moving base of patella inferiorly. When flexion is progressing, patella rotates the femoral condyle in downward direction. Finally, patella rests over intercondylar notch for full flexion. Downward rotation of patella on femoral condyle in sagittal plane is patella flexion. Superior gliding and upward rotation of patella in sagittal plane is patella extension. Medial and lateral tilt. Now guys, make sure that you're on a bed where your knee is fully extended, where your patella will be really free. So yeah, let's begin. So as you can see on the image here, where the medial side, like the medial side is lifted, right? So when the medial side is lifted and when the lateral side touches to the lateral condyle, what happens? And that is lateral tilt. And then when it comes to medial side, where the lateral side is lifted or away from the condyle and the medial side touches to the medial condyle, is known as medial tilt. Good. And now coming to the medial and lateral shift. So in this movement, the patella moves sideways, medially and laterally. Just move it right and left, right and left. Yeah. And coming to next is medial and lateral rotation. So here the patella rotates medially and laterally, as you can see on the image, same in that way. Patella alta and patella baja. So this is an important remarker and they are very easy to learn. So let's begin. Patella alta, position of patella gets higher due to increased length of patella tibial tendon. So as you can see here, patella alta, it settles high, right, on the distal part of the femur, the lower part, right, just below, just above the distal part, you can see here. So yeah, coming to patella baja, position of patella gets lower due to increased length of patellofemoral tendon. As you can see, the patella settles lower. So that is patella baja, and patella alta is also known as grasshopper eye patella. Congratulations guys on completing knee complex, and good luck guys on your exams. So please do like, share and subscribe, and yeah, see you on next video. Peace out.